Hi, my name is Nicole Lamana, Associate Professor of Medicine at Columbia University Medical Center in New York, and CLL doctor. And I'm here with my friend and colleague from MD Anderson, Dr. Nitin Jain. Nitin, you want to introduce yourself?
Sure. Yeah, hi, I'm Nitin Jain. I'm at the Leukemia Department at MD Anderson in Houston, and I treat patients with CLL and run clinical trials for patients with CLL.
And so we're bringing to you highlights from ASH, so virtual ASH update. And we're talking actually today with Dr. Jain about one of his studies that looks at a combination of different medications, including a newer drug that we don't use very often in CLL called a PD-1 inhibitor. And he's going to talk about that. And this is a study that was in patients who transform. We call it Richter's Transformation, and we'll talk a little bit more about that, but it's a combination study in those individuals. Dr. Jain, you want to talk a little bit about the combination?
Sure, yes. So, Richter's Transformation is an aggressive form of disease where the CLL cells get converted into a large cells, and that's called Richter's Transformation. Generally occurs in about 5% of patients with CLL. And we and others have previously done some work where we had shown this checkpoint inhibitors. So in our immune system, there are these T cells. And these T cells have certain proteins on the surface of them, which makes them not function very well. And that's what happens. One of the things in patients with CLL, as well as Richter's, is that your immune system is not working perfectly. So if we can somehow activate these immune cells back with some agents, that's one of the strategies called checkpoint inhibition. These are the checkpoints on these immune cells. And this kind of strategy has really established a lot of, it's a standard therapy for a lot of solid cancers now, melanoma, lung cancer, other cancers. So some years ago, we started working with one of the other checkpoint drugs called nivolumab, which is called a PD-1 checkpoint inhibitor. And some other groups are also working at the same time. And now that drug has been added to the NCCN guidelines, so potentially a doctor could prescribe it to you for patients who develop Richter's Transformation. So a couple of years ago, we started working with this PD-L1 checkpoint inhibitor. So that's a different class, which depends on where the target is, which part of the circuit, I guess, you're blocking. PD-1 is on the immune cells, and PD-1 is technically on the cancer cells. And that's a study we designed where we used a PD-L1 checkpoint called Atezolizumab. We combined it with Venetoclax, which is a common drug for CLL. It's a pill. And then we also added Obinutuzumab, which is an antibody, a CD20 antibody for CLL patients, which a lot of CLL patients are receiving for their CLL. So this was a non-chemotherapy combination, so no chemotherapy. And then these three drugs together. And we treated patients who had both newly diagnosed Richter's, meaning that they had CLL, they got some therapy for their CLL, for example, ibrutinib, and then they developed Richter's. And then we had one patient we treated who had relapsed Richter's, who had failed chemotherapy before for Richter's, and then the patient was enrolled on the study. So far, it's an ongoing study. What we reported at the ASH meeting, we treated 7 patients with this drug, 7 patients who are newly diagnosed Richter's. So they had therapy for their CLL, and then they developed Richter's. And in fact, we saw that all 7 patients responded, and 6 of the 7 patients achieved what is called complete metabolic response, where when we do a PET scan, we don't see any increased lighting up of the area. So everything was kind of settling down. And some of these patients then were able to go to bone marrow transplant, which is considered to be a definitive therapy for Richter's Transformation. So overall, early data so far, but it looks encouraging. And the trial is open right now, so we're trying to enroll more patients to see if this would be a non-chemotherapy strategy for patients with CLL, for Richter's.
And I think what's important, for patients to know is that, right, so the traditionally for patients who transform from their CLL to a large cell lymphoma, this Richter's transformation, and that's the most common that patients can transform to, is traditionally we would give chemoimmunotherapy. That's what Dr. Jain is referring to, is that we'd give traditional chemoimmunotherapy for this problem, but it often didn't do so well, right, Dr. Jain? It often was not definitive or highly active compared to our patients who don't have CLL who transform, so really true large cell lymphoma patients who don't have CLL. And so we'd use the lymphoma regimens that are commonly used to treat that, but they wouldn't work so well in our CLL patients who transformed. And so we're always looking for newer strategies such as this to treat patients with Richter's, right, Dr. Jain?
Yeah, quite true. So the chemotherapy, the published literature suggests that, if you give chemotherapy for patients with Richter's, maybe about half of the patients achieve a response. So certainly half of the patients are not achieving a response, and the patients who achieve a response, the disease can come back again. So certainly I think we need new therapies for Richter's patients, and I think this is one of the strategies, as I mentioned, we are exploring at MD Anderson.
And I think it's a nice strategy because many of our patients who get chemoimmunotherapy, oftentimes that treatment is also sometimes somewhat harsh on them, and they have a harder time with the sort of the traditional chemoimmunotherapy that's often used for large cell lymphoma patients. And so our CLL patients don't necessarily handle that as well, nor is the efficacy or the responses as good. And so we're always looking for new strategies. And this is an early study, but hopefully, there'll continue to be some promising outcome, because certainly this is the kind of thing that we want to get rid of, right? Patients really can't live with this. So we're looking for newer treatments. And so this is an update on this promising combination regimen with a PD-L1 inhibitor, checkpoint inhibitor, for patients with Richter's transformation.